Right. So you mentioned a few challenges that you encountered. And in the health tech space, can you pinpoint a few specific challenges in engaging patients as well as working with clinicians or providers? Because this space is filled with challenges. And but how did you overcome these challenges?
Well, I guess the first, and obviously there's a lot of research and work I did as it came up and this idea evolved. But fundamentally, it was because of my background to your earlier question about engagement. The key thing I thought was the first thing to do is reduce the barriers of communication and the barriers of engagement. And at the time, and frankly, still today, a lot of times the health system and solutions are telling people how to communicate. They're telling them, you got to do this, you got to use this machine, you got to use this device, you got to use this app to communicate. And that's, you're immediately going to have people push back because people want comfort. If you want to do something that's complicated, you got to give them their comfort. So let them do what is best for them and what is easiest for them. So my whole concept was to allow the patients to determine how they're to communicate and with what device they wanted to communicate. And don't tell them you have to do this because there'll be enough they're being told. So reduce those barriers of communication. On the clinical side, these are all generalities. On the clinical side, frankly, the biggest pushback was how do you deal with a fire hose of data and information that a clinician can possibly get now with this kind of approach? Because now the patients say better communicate, you can get more information, but the clinicians don't have the time for more information. They don't have time for discern what all this was. So at the same time, we had to come up with a solution that actually went through and provided the clinician with the information they needed when they needed it as well. So similarly, dealing with their engagement issue and their barriers of communication to give them what they needed. So you had to be in any solution in health tech in general. It's not just I'm going to help the patient, I'm going to help the clinician, I'm going to help the nurse. You've got to be aware of the entire ecosystem that you're dealing with and make sure that each stakeholder in that process is having their issue addressed and provide and solved in that process. As otherwise, that solution flow is not going to come through. It's not going to work because each one will be a friction point and a barrier to success.
No, you're absolutely right on this because especially in healthcare and with any entrepreneurship journey or any target market or target audience, and you really hit the nail on the head on with this one, uh, that you really have to get the end user involved. And in this case, the end user is the patient as well as the clinicians, as well as the providers and the doctors and the nurses who are involved. And in healthcare, it makes it especially more challenging because it is so multidimensional, as you mentioned. And for any healthcare startups or founders out there, you have to really look at your tech product as a replication, how it can replicate the on the ground situation, and that is going to be hugely important. And especially with a disease like diabetes, where the variables and interactions or insights or readings are multiple times a day. So you have to really meet the people where they are and try to replicate that environment and see how where are the issues issues and identify those issues, and see how you can aptly control for them and aptly provide solutions for them. um,
Exactly.
is that
And
what
in
you
fact,
felt when you first yeah.
as I learned and sort of got educated, in all these particular areas, and frankly, that's why the whole area expanded into behavioral health. So it's just chronic diseases, but also behavioral health for the same because there are all many of those same kind of fundamental issues.
Right. Can you talk a bit more about that? How was behavioral health incorporated, which is of course a huge aspect of it? What aspects did you get into with this?
Well, what part of it was, it really came down to an opportunity set. Like we were working, the early days showing what we can do with diabetes, and we had an opportunity to actually work with the VA, actually an NGO outside of California, dealing with uh, veterans suffering from post-traumatic stress and subject to high-risk suicidal events. And so we were asked, can we take the same approach, obviously using the assessments and clinical approaches for PTSD and high-risk suicide, but that same communication approach off my platform. And we did, and we had a fair success to the extent that we were able to help the veterans, and that's how it sort of evolved into this broader behavioral health approach.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. And just check the links in the description or what you see on the screen right now. I'm Dr. Umar Khan. Looking forward to seeing you again. Thank you.